Makoplasty partial knee resurfacing may be right for you. The knee is made up of 3 compartments: the medial, lateral, and patellofemoral. Osteoarthritis typically begins in the medial compartment or on the inner side of the knee. During the early stages, you may have to limit some daily activities. You are usually able to pinpoint exactly where the pain is located simply by pointing to it. If pain persists, the physician can inject the site with a corticosteroid to reduce inflammation and manage pain, or prescribe anti-inflammatory medication. But as the disease and pain progress, these treatment options may no longer be effective. During early to mid-stage osteoarthritis, Makoplasty, a minimally invasive partial knee arthroplasty, could be a successful treatment option. During Makoplasty, the diseased portion of the knee joint is removed and healthy bone stock and tissue are spared. Once the disease progresses into the patellofemoral compartment of the knee, partial resurfacing of both the medial and patellofemoral joints may be an option. Otherwise, your only surgical option is total knee arthroplasty, during which large amounts of healthy tissue and bone must be removed along with the diseased portions. And this can result in a significantly longer recovery time following surgery. Today, there is new hope for adults living with early to mid-stage osteoarthritis. There's Makoplasty. Makoplasty is a minimally invasive procedure that's enabled by a robotic arm system that assists the surgeon in achieving optimal resurfacing and placement of the implant. Each procedure begins with a pre-surgical CT scan of the patient's knee. This information is then digitally scanned into the MAKO system for the surgeon to use in making a custom pre-surgical plan. This plan details every step of bone preparation, resurfacing, and implant positioning during surgery. This careful planning facilitates the most accurate positioning and precise alignment of the implant possible. During Makoplasty, the bone is minimally resurfaced, saving valuable bone stock and sparing tissue. The pinpoint precision and consistency afforded by the robotic arm system that assists the surgeon during the procedure provides a more natural feeling and functioning knee following surgery.
Makoplasty Hip is a revolutionary surgical treatment option for adults needing total hip arthroplasty. RIO Robotic Arm Interactive Orthopedic System assists surgeons in achieving a new level of precision and more ideal hip implant positioning. Surgeons preoperatively plan each patient's Makoplasty total hip procedure. The CT scan and RIO provide a 3-dimensional view of the joint and diseased anatomy, enabling an optimized procedure plan. Cup inclination, cup version, combined anteversion, and postoperative leg length are critical elements of total hip arthroplasty and are accurately planned for the individual patient preoperatively. During surgery, the patient's unique hip joint is registered and aligned to the preoperative plan. The surgeon plans and accurately defines the level of the femoral neck resection in order to achieve ideal leg length restoration. Once the head of the femur has been removed, the femoral canal is prepared using broaching instruments. The broach tracker is applied on the taper of the trial-femoral stem, and femoral version is measured. Utilizing the femoral version, the orientation of the acetabular cup can be intraoperatively adjusted to provide the optimal biomechanical reconstruction that is specific for each patient. During Makoplasty, the RIO provides tactile feedback, 3D visualization, and auditory guidance as the surgeon prepares the acetabulum for the implant. The surgeon is assisted in providing accurate and controlled preparation of the acetabular bone to ensure the cup is placed according to the patient's unique surgical plan. The RIO-assisted cup impaction step of the Makoplasty procedure begins by easily switching from the acetabular reaming tool to the cup impactor. As the surgeon prepares to impact the implant into its final position, the RIO holds the acetabular cup at the desired inclination and version defined in the surgical plan. RIO also assists the surgeon in determining when the cup is fully seated Surgeons can then evaluate the position of the implants and the post-operative leg length before leaving the operating room with a new level of confidence using robotic arm technology. MAKO Hip, providing a new level of accuracy and precision to total hip arthroplasty.
Έχουμε την ιδιαίτερη χαρά να έχουμε στην Ελλάδα τον νούμερο 1 γιατρό ρομποτικής ορθοπαιδικής στον κόσμο, τον Dr. Frederick Bickel Jr. Ήρθε κοντά μας για την έναρξη της ρομποτικής ορθοπαιδικής στην Ελλάδα. Είναι μια μέθοδος που έρχεται να δώσει λύσεις σε προβλήματα ασθενών στο γόνατο και στο ισχύο. Οι ασθενείς κάνουν επέμβαση ελάχιστης επεμβατικότητας, φεύγουν την ίδια μέρα ή την επόμενη από το νοσοκομείο, χωρίς πόνο, χωρίς επιπλοκές, χωρίς απώλεια αίματος. Θα πει λίγα λόγια όμως και ο κύριος Μπίκλ, λίγα λόγια για τη μέθοδο στα αγγλικά και θα μεταφράσουμε. If you can say a few words for what we need.
Yes, so over the last 2 days, I had the honor to work with these fantastic Greek surgeons doing the first robotic knee replacement surgeries in this country. 4 patients so far have undergone the robotic procedures quite successfully. This process allows patients to return to an active lifestyle quickly with a high precision installation of their joint replacement. Each and every patient's installation is customized to their specific knee with a very sophisticated software planning system and a robot that allows the surgeon to perform the procedures with very high precision each and every time. So I'm very excited for Greece and Metropolitan Hospital and our surgeons here to have such a fantastic tool at their disposal, and they've done a wonderful job over the last 2 days with their procedures, and I'm sure there are going to be hundreds and thousands of Greek patients that are going to benefit from this experience.
Thank you very much. Thank you very much. We're extremely happy with the experience working with you. Learning so many things from you.
I'm very impressed with the Greek surgeons. They're fantastic.
Ο κύριος Χίσας, ορθοπαιδικός χειρουργός εξειδικευμένος στη ρομποτική, είπε και αυτός μερικά πράγματα για το τι κάναμε.
Πρόκειται για μια επαναστατική τεχνολογία, η οποία πλέον εφαρμόζεται αποκλειστικά στο Metropolitan Hospital. Είναι μια τεχνολογία η οποία μας επιτρέπει να θεραπεύουμε ασθενείς με οστεοαρθρίτιδα, επεμβαίνοντας μόνο στο παθολογικό τμήμα της άρθρωσης. Μέχρι τώρα οι περισσότερες μέθοδοι αφορούσαν όλη την άρθρωση, υποχρεωνόμασταν να αντικαταστήσουμε με ολική αρθροπλαστική την άρθρωση. Πλέον οι ασθενείς έχουν μια νέα σπουδαία επιλογή μπροστά τους, μπορούν να θεραπεύονται γρήγορα και αποτελεσματικά, να επιστρέφουν σε πλήρεις δραστηριότητες, ακόμα και αθλητικές, να έχουν πάλι το γόνατό τους φυσιολογικό. Ευχαριστούμε πάρα πολύ τον Dr. Bickel και τους συνεργάτες για αυτή την σπουδαία εξέλιξη. Ευχαριστούμε πολύ.